Well, my next guest, I'm really anxious for him. I hope he can become a part of the show on a permanent basis. Health and nutrition, as I've told you folks several times, is a big part of my life. I live it, I breathe it. And we're going to be talking about James Gandolfino. So please make a very warm welcome for the first time to the Rob Dennis Show, Dr. Rob, everybody. Hey, oh. How are you? Nice to have you on, Dr. Rob.
Yeah, thanks. Great to be here.
I was very impressed because I watched Living Dayton, and I saw you on. I said, now there's a guy I got to get a hold of.
And I'm glad you did.
Health and nutrition has always been a big part of my life. As I told you, for many years I was with Steve Zach Holiday Health Spa. Thank God, because that taught me how often to work out, when to work out, how to take vitamins, when to take vitamins, what vitamins to take. And I just feel like I want to give everybody this information. Then people say to me, well, I keep forgetting to take them. I said, wow, isn't that strange? But boy, you don't forget to go to the lunchroom, do you? Put them in a box and put them in your purse, you know, that type of thing. So when I talked to you on the phone, I said I'd like to talk a little bit about James Gandolfino.
Yeah.
And tell me what you observed as you watched The Sopranos.
James Gandolfini, one of my favorite actors. I was loved The Sopranos every Sunday night, watched that show. And I would let myself go and just be entertained by his magnitude. He's just a wonderful, gifted actor. But as a physician, I would always wonder in the back of my mind, you know, big heart, big guy, big frame. I wonder what kind of heart disease he has. I wonder if he has diabetes.
Every time I saw him.
Because when your front part, when your stomach is at least half the size of your height, you know, it sticks out that far, you got trouble, and it's brewing. And
it's pressing up against the pancreas. And
well, you've got all that fat, right? And that fat, it secretes all these cytokines, these very powerful inflammatory markers, and they can destroy the arteries and veins in your heart, your brain, and your kidneys. And so when you've got all that extra weight, you also become insulin resistant. So the effects of the insulin, which brings your blood sugar down, doesn't work as well. And so it sets you up for all kinds of diseases, for heart attacks, for strokes, for diabetes, for osteoarthritis and thinning of the bones, osteoporosis and osteopenia. So, you know, as a doctor, when I see people, I size them up very quickly medically, like where are they at? And I look at you and you're unbelievably fit for 97.
Well,
Yeah.
I'll be 98 next
Really?
May, young fella.
You look great.
Well, you're saying that because...
And I know how much you like to ride your bike, and that's great exercise. And that's one of the cornerstones of good health is regular, meaningful exercise, besides eating healthy and taking your supplements and getting a good night's rest and drinking plenty of water. You know, water is something that we need to drink a lot of. Most of us are walking around in a very underhydrated state. And taking your supplements. I mean, Tim Harrison, that alligator, it's such a sad story. I mean, those are the effects of vitamin D deficiency, and people can suffer that as well if they don't get their appropriate supplementation.
And I'm sure you're aware of the new findings. I read a report where 1,000 women were tested for breast cancer. Out of the 1,000 women, those that showed tumors had no D in their system. Those that didn't had normal levels of D or higher levels of D.
And I'll tell you what, in Ohio, and I test for, in our institute, the Alpha Male Medical Institute, vitamin D is one of the things that we check for, and almost universally in Ohio, everyone's just about deficient. We don't get enough sun here.
That's right.
You know, there's the good 6 months out of the year, it's either gray, gloomy, rainy, snowing, and so you're not going to get the vitamin D that you need, and you're going to need to supplement. And then there's people who have, you know, milk allergies or intolerances, or they don't eat enough fish. Things like sardines and mackerel, the heavier fish that are full of the vitamin D and the calcium. And so,
Dr. Rob, you got a new institute out, right?
yeah.
Do you take puppets because his look a little bit vitamin D deficient?
Yeah.
They
Is
get out
it a
lot.
male puppet?
Well, no, it's a female, but she's got some issues.
Yeah, well, it's the Alpha Male Medical Institute. So
Oh,
I don't know.
so we'll have to find another.
Yeah.
one.
Well, tell us about that.
So that was interesting when you had your hand up. I have to do it. Of course, I don't stay there as long as you do.
Right.
I'm
Yeah, I'm
usually
kinda sick.
prostate exam. It's very quick. I'm in. I'm out.
It's a
you know.
dirty job, but I have fun with it. You know what I mean?
Don't they arrest people for that?
They may. Yeah.
What state is this?
If you're not a doctor, I imagine they would.
When you mentioned the amount of fat, and I try to explain to people, a person like me, when my heart beats, boom, boom. boom, boom. To a person that's excessively overweight, boom, 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 boom. It takes that long for the blood to get down here. That's not
Your heart
good.
has to, when you're not your ideal body weight, when you don't weigh what you should, and there is a range, everybody has a weight range, your heart has to work harder to do the job. It's a closed system, so it's pumping against this resistance. It's like a garden hose. You turn the water up really high and it comes out faster. Well, and it can damage the hose. Well, when your heart has to work harder like that and it has to push the blood through narrower arteries, it's causing damage in there, and that's problematic. So, and when your heart's got to work harder, it's not going to last as long as it should.
And we have to explain to people also that exercise working the heart is different
It is.
than the overweight. But people that have had this bypass surgery, the sugar diabetes goes away within a week or two. What is up with that?
Well, in some cases it does,
Some
not
cases,
in all cases. So in order to keep away from having that insulin resistance and becoming pre-diabetic or diabetic, nutrition, eating healthy foods on a regular basis, keeping to the lean proteins.
Raw foods.
Yeah, raw foods, unprocessed foods, the chicken, the turkey, the fish, the beef. Cucumbers are great. The vegetables, okay, seafood, the low sugar fruits like apples, blueberries, raspberries, strawberries. You can eat plenty of food. You don't have to diet. You just need to eat the healthful foods. Stay away from the processed foods that are full of the nitrates and the sugars and all the additives and preservatives. I don't want to preserve myself. I want to keep everything healthy. You want to keep everything healthy in your body. And so eating healthful foods on a regular basis, getting regular, meaningful exercise. And when you get out there and you exercise and you stress your body, helps lower the blood sugars, helps clear the cholesterol out, helps strengthen your muscles and your bones. And so your body was meant to move. It was meant to be exercised. And you got to get out there and do that every day.
Oh, okay.
In the Institute, in the Alpha Male Medical Institute, one of the tests that we do is a carotid ultrasound. So we physically look in those carotids. And so we get a picture of those. And when you see the disease in people's arteries, you know, if they've got it here, they've got it here. And we know that the omega-3s are great anti-inflammatory and help clear the plaques out. So I take my omega-3s every day. I don't want a plaque here. I don't want to have a heart attack. I don't want to have a stroke. You know.
I had that test. I go in there, and I just know I'm dying. So I lay down. She puts the gel here and puts the things, and she turns on the machine, and it blasted my ears out. I said, "Oh my God, what is that? I'm dying."
Yeah.
She said, "You've got the blood flow of a 20-year-old. You want to hear. When you don't hear the sound, that's when you need to worry."
She didn't tell you the Doppler was on, but that's a great sound to hear. When you hear that nice beat through there, yeah.
But I try to say to people, Dr. Ron, I've said it several times on the show, you women, get those annual mammograms, and you men, get off your lazy rear end and get that colonoscopy.
The colonoscopy, you know, and that goes for women too. Women should have their colonoscopy too, you know, because colon cancer is as prevalent in women as it is men. So they need to have that screening exam, especially if they have a family history. They should get it sooner, but at least by the age of 50. So the colonoscopies, whether you're a man or a woman, very important. For women, get your mammograms. It's a simple test to do. The new machines that we use now that they have to put their breast in, it's not as uncomfortable as they used to be. And one test, simple x-ray, doctor can interpret it, and you're good for the next year or so.
There's another test out there that, I forget what it's called, other than the mammogram. Have you heard about it? 3D imaging.
Mm-hmm.
And a woman told it on the Inside Edition. She had her test. She's fine. Her sister said, "Get 3D imaging. It's cheaper. Just do it for me. I've already been tested. Do it for me." She did it, had cancer tumor that the mammogram did pick up, 3D imaging.
And that's
I've got
true.
8,027 billion questions. You've got to become a regular on the show.
We'll see what we can do to answer at least a couple.
Well, you know, when people...
That's a lot of shows, by the way.
Evidently, you didn't have a lot of puppet
Yeah,
questions.
really.
My spot was a little shorter, Dr.
But
your
when
puppet
people watch
okay?
the
Not that I'm
show,
bitter, I should
I
be
want them to
fine.
be entertained. I want them to have a good time, and I want to educate them because health is so important. Not only to me, it should be important to everybody because a husband doesn't want to lose a wife, wife doesn't want to lose a husband or a child. You need to educate people for health and nutrition.
You know,
That's what I try to do.
One of the things I tell my patients is the only home you'll truly ever have is the body that you live in. So you need to take care of that body so you can go do the things that you want to do with your life.
do everything right, exercise right, eat the right food, so that when you retire, you ride a bike instead of a wheelchair.
And you can have a show in Dayton, Ohio.
There you go. There
Right.
you
There you
go.
go.
Thanks for coming, Dr. Ross.
It was great to be here.
You've got to
Thank you.
become a
Thank you.
regular. I've got 8 trillion other questions I need to ask you.